Bowman, here you are. You're on stage with me. How are you today?
Great. How are you?
I'm good. I'm good. Dr. Bowman is going to be speaking. We're going to go straight into our next session. Dr. Bowman is going to be speaking about swine diseases.
Yeah.
And um, I suspect, correct me if I'm wrong, you have some content about African swine fever as well. Is that accurate?
I do have a little bit of that, and I think I'm probably going to pick up a little bit where Dr. Price left off on some of those things.
That's awesome. Okay. I want to introduce you and then I will step off the stage and I'll add your slides into the presentation for you. So, Dr. Andrew Bowman earned his BS agriculture. Oh my goodness, I'm gonna butcher all this. I apologize so bad, so much. His Bachelor of Science agriculture, his Masters of Science, and his DMV and PhD all from Ohio State before returning to his alma mater to advance research and education. He is an expert on zoonotic and emerging infectious diseases at the intersection of animal and human health, and he also holds a courtesy appointment at the College of Public Health's Division of Epidemiology. And so I appreciate you being here with us, Dr. Bowman. I love that you're going to pick up where Dr. Price left off, and I will turn it over to you.
Yeah, thanks. So, the danger in asking a professor to talk is you get a lecture. So I'm gonna try to do my darndest to keep this fun and light, and we'll go from there. So we're just gonna do kind of a bit of a crash course of swine diseases. Dr. Price was talking about some of these, and realize we have varying expertise levels in the audience, and so we're going to dive right in. I think one of the things that Dr. Price hinted at, right, kind of was the idea that we find problems on almost every farm. And so, when I was in private practice, one of the things I hear people say is we don't have any diseases in our herd. And like to me as the veterinarian, that's a big old red flag, right? I think every single herd has some disease challenge that we're trying to deal with. And so, as we're kind of trying to think through some of that, um, we certainly can come up with things that we could do better on the farm. And so first step in that is really trying to understand diseases. How do we find these problems, right? And so, I know like it's difficult doing chores some days, especially if we're talking about we've got all sorts of competing activities and all sorts of everything else to do. But you've got to get into an observation mode where you're really trying to see every pig every day, right? And this is one of those things that we preach is, hey, every pig every day, and that kind of involves looking at your barn in multiple levels. So the barn level, the pen level, and then the individual pig level. And so I know, like I am guilty of it too, as I talk about a barn full of pigs, and kind of as the picture represents, like I'll say, a barn broke with purrs or something like that. But realize that's made up of a whole bunch of individuals, and so we really need to look at every pig every day as we're trying to do our chores. And so, I try to teach people to, and this was something that came about, man, when I was way back in practice, is kind of ABCs. We're going to try to score sick pigs A, B, C, right? And so we've got healthy pigs, and that's, by golly, that's what we'd love. But if we're looking at sick pigs, A pigs are those early pigs, they're just starting to show signs of sickness. A really acute observation might pick that up. B pigs, they're visibly ill, and then C pigs are seriously ill pigs. And so as I kind of think about the ABC pigs, right, you want to try to find A pigs, right? If you can find a pig when it's just starting to get sick, right, that's the point in time when intervention is going to be the most effective. Lots of those things that we were just hearing Dr. Price talk about, hey, if you find it when it's an A pig, you got a lot better chance of getting this to get turned around. B pigs, right? That there's something really going on. Our treatment success starts to go down, and then C pigs, right, really are a problem. This is where we hear like, man, I've thrown every drug I have at them, and they just aren't turning around. We found them too late, right? It's the same as you and I. We want to catch things early, a much better chance of a successful intervention. Right, so when we're saying every pig every day, I don't mean you have to pick up every pig, especially we know once they get big, you're not going to pick them up, but you really need to make certain you see every pig. All right, you're looking head to tail as you go through there. You can read a lot on just how they carry themselves, how they're breathing, how they look, right? And you all get good at this, but you tend to like, right? I'm guilty of it too. You kind of look across the group, but once you get your eye trained, you can really start to find those abnormal pigs pretty quickly. I always joke I've got daughters at home, but bad hair days, right? Bad hair days on pigs is the hint that there's something up, right? The hair gets rough. They just aren't looking quite right. Investigate a little bit further. Find those pigs that are there. There's some sort of problem, and then from there investigate further. So know your treatment limitations, right? We want to find A pigs, B pigs we might have a shot at. C pigs are a problem. So this is kind of a grainy picture showing up. But if C pigs are all that you find, you need to practice finding sick pigs, right? If you find the pig in this state, you're not going to turn it around, at least not quickly. So you really have to practice finding those pigs early. Once you find them, then it gets to the question of what are we going to do with them and what do they have, right? So one key thing we're going to try to talk about as we go through this is zoonotic disease. Hopefully you know this term. If not, right, it's one that can be spread between animals and people. And so we just have to give a little bit of an idea that those diseases could be potentially harmful to us as well. And so a little extra protection is going to be needed. So a truth of life safe enough to tattoo on your body somewhere is that young things get GI disease and old things get respiratory disease. Now, it's not, right, like a hard and fast law, but overall, right, young things get diarrhea, old things get respiratory. And so, as we start getting into some of these diseases, as I teach the vet students, common things happen commonly, right? And so you really need to think about the common things. And so I'm going to try to just cover some of those common diseases as we go through this. Are there a lot more? Heck yeah. But right, common things happen commonly. So we're really going to think about these. As we think about causes of disease, especially in neonatal pigs, GI disease, the things we really think about are these kind of coronaviruses. Gets a lot of attention. Not the pandemic coronavirus. These are other coronaviruses. PED is probably the big one we think about. Porcine epidemic diarrhea virus. But rotavirus is an ongoing problem. Clostridium or Clostoroides certainly causes problems in those neonatal pigs. E. coli, very common. And then coccidia is another one. So I guess I think those top lists there, that's really neonatal pig diarrhea from infectious causes. Those are what we think about. A few of those are vaccine preventable. Some of those are management related. That's really where we stay focused, right? If we can look at those, that's most likely. As we get out into older pigs, Salmonella certainly creeps in, and then we see some Lawsonia. We would also call that ileitis. I think generally in grow finish pigs, if you're seeing diarrhea, like Lawsonia or ileitis is probably the most common cause, right? I think it's still over half of those cases, right? If I could go to Las Vegas and bet on grow finish pig diarrhea, I would bet on Lawsonia, and right, I'm probably going to come out a winner. Almost all of these cause diarrhea. Some are going to cause vomiting and some other things along the way, but nonetheless, right? This is so when we've got those pigs with loose stool, this is probably where we need to kind of think about. Maybe we'll get into some parasites, but this is where I'd start. PED. It's bad news, right? Like this is a PED outbreak on a commercial sow farm when it first got here. So you might be saying like, do I have PED or not? This is what it looks like in a farrowing house, right? This is a whole bunch of mortality due to porcine epidemic diarrhea virus. You can see diarrhea in all ages of pigs, but if you're ever wondering, like, do I have that nasty virus? If you don't have a pile full of dead piglets in your farrowing house, probably not PED. You can also see why in the world we are so scared of this virus, why we don't want it around, right? If you've got bred sows, PED is the last thing you want to have come around. So in general, what are we saying? The PPE that you should be wearing if you think you've got pigs with GI diseases, right? Rubber boots. We've certainly talked about security, but right, something we can clean and disinfect. Gloves, some of those, right? E. coli and the such, some other GI bugs you could certainly catch as a person, and then some sort of protective clothing. especially something that we could take off and not take to another farm. Um, Other things that we want to think about, right? Respiratory disease. And so as we get into some of these swine diseases, porcine respiratory disease complex is kind of this general term that we throw at all sorts of the things causing respiratory disease in pigs. So, what are those? PRRS is certainly common. Influenza is common. Circovirus, mycoplasma, and then a whole bunch of bacterial agents. So realize that we've got all these players on the stage. They don't all contribute equally, and so we kind of need to think through this. And so as we think about this porcine respiratory disease complex, right, it's this idea that there's multiple organisms, multiple insults happening to the respiratory system, and you get this mixed infection. Rarely, and I mean rarely, is it ever a single pathogen, right? And so we hear all these sorts of things about, oh, my pig had X, Y, or Z, or I had this pathogen, but realize it's a lot of different things going on. In fact, you can go into a herd and you could sample all sorts of all multiple pigs through the herd, and you're going to get different profiles in each of those pigs. Now, there may be one common underlying major pathogen, but you see lots of things going on in there. And as Dr. Price had just alluded to, stress can be the thing that really tips that off, right? So you've altered the normal physiology of the pig somehow. Something's able to get in, and the next thing you know, you get some sort of disease event that kicks off. So the way this typically works is you get some sort of kind of opening act, right? We think about PRRS or flu, mycoplasma, one of the virals, maybe circovirus, that is that opening act, right? You get that infection, and that in and of itself maybe isn't that big of a deal to the pig. We certainly see some mild strains of PRRS or flu or PRRS that might really not be that big of a deal, cause a little bit of disease, but then they get some sort of secondary bacterial infection on top of it, right? And so from there, right, we get some more serious disease. The lungs maybe become more susceptible. We get more secondary bacterial infections, and then right we get this kind of synergistic effect where the overall disease gets much worse. And so that's why we care so much about some of those viral things. Flu in and of itself, it's probably going to be a pretty quick blow through the pig herd, but you get all these other secondary bacterials on top, and then you've got real trouble. So as we think about that, we divide it into the viral and bacterial, right? So if you got a PRRS outbreak and your veterinarian prescribes some sort of antibiotic, your vet didn't fail vet school, right? We know that we can't treat the virus, but we're trying to deal with those secondary bacterial infections that we know are coming, right? And so as we think about that, is right, we got to try to get ahead of those secondary infections because we know they're coming. We got this whole host of different pathogens. I'm not going to dive into all those, right? This is the perfect place for you to exercise that veterinary client-patient relationship, get some idea of what other pathogens are common in your area, and then what the appropriate antibiotics would be. So as we kind of think through, right, some of those clinical signs, right, this is general idea. I think we all know a coughing pig, right? But sometimes we dismiss it, especially at a show, some version thereof, right? It's the shavings, it's the cool air, it's the something else, whatever, right? We got to investigate those things. Certainly, if we toss on fever, anorexia, so they're not eating, they're not getting up, right? They're sunken in, they're not looking thrifty, and then we get the thumping, right? All of those are great signs that we got some sort of respiratory disease happening, and we need to get to the bottom of it. Realize in lots of these cases, you may only see a few pigs. It's the tip of the iceberg effect, right? You may see a few pigs severely affected, but lots of the pigs are going to be infected, and then right, the disease is spreading through the herd. So if you got a couple, there's probably more. What do you need to do, right? Same sorts of things as we saw before. However, realize that influenza is zoonotic, right? You can get it. People at higher risk for complications from influenza infections include the young, the old, immunocompromised, if you've got some other health condition. So a face mask would be certainly reasonable to recommend in those situations, right? We just really need to consider, while most of the other things on the respiratory list are not zoonotic, influenza is, and if we get a pig to human transmission of influenza, right, and that gets detected, then the next thing you know, we might have the next public health investigation, or if it's sustained, we might have the next pandemic. And so we really do need to take precautions in those settings. As we think about repro diseases, I'm kind of around the wheel of production here. If we get around to gilts that are coming back into the herd, right, we're kind of thinking about these repro diseases. PRRS we mentioned back in the respiratory section, but repro is a main thing here. And so when I get any sort of call about, hey, I've got a herd, some sows with some sort of repro problems, I think you have to assume it's PRRS until proven otherwise. Right? Dr. Price was saying itchy pigs are mange until proven otherwise. I'm going to say repro problems in pigs are PRRS until proven otherwise. Right? I had one not too long ago. Somebody called me up and they were certain that it was mycotoxins in the feed. And I was like, hey, have you looked for PRRS? And by golly, as soon as they look for PRRS, there it is. Right? So I think, we've really got to consider PRRS. Parvo is one of those that's hanging out there. It causes this fun little thing called SMEDI, which is stillbirths, mummies, embryonic death, and infertility. Realize PRRS can cause the same thing, but parvo tends to be isolated to gilts as they're coming in for their first breeding. Parvo is classic for these stair-stepped mummies, and so if you get a gilt that puts mummies on the ground, maybe some stillbirths, right, I'd be suspicious of parvo. The good news is once they've had parvo, they're going to be immune probably for the rest of their life. Nonetheless, we can control that with vaccines. Lepto, likewise, it's going to set up an infection sometimes in the kidneys, can cause late-term abortions. And when we think about preventing, especially the repro things, PRRS is tough, right? That's a RNA virus that changes a lot, but parvo, lepto, and then erysipelas, which we'll talk about in a second, are usually sold in a repro vaccine, abbreviated PLE. Take your pick of which brand you want, but PLE is a very common vaccine which would allow us to control parvo, lepto, and erysipelas, which are the majority of our repro diseases. Lepto, I'm just going to throw in there, right, is zoonotic. It can cause some nasty infections in people, and so again, take those precautions if you're out there dealing with sows that are aborting. Really want to make certain that we don't end up infected as well. Erysipelas, I just mentioned, right? I think this one we kind of all know, diamond skin disease. Can I come up with other things that cause similar looking lesions? Yep, sure can. But I mean, I think even if you ask the newbie vet students, diamond skin disease, erysipelas, right? That's what we're thinking about. Can you treat it with antibiotics? Yep, sure can. Thing to remember, though, it can be transmitted to humans, so cuts on hands and those sorts of things. So you certainly could get it. If you're going to go down kind of dealing with that and you're really looking at pigs that you think might have erysipelas, gloves are going to be a big one, especially other protective clothing, but gloves, big time. That's where most people get infected with this, a fairly common infection among folks raising pigs. Strep suis, or take your pick of other neurologic diseases. And, if you talk to a commercial swine farmer, they're going to almost call every neurologic pig strep pig, right? I hear it all the time, strep pigs. And so what do neurologic pigs look like? Neurologic pigs tend to head press. Maybe they'll dog sit like this. Next thing you know, they're down and on their side, paddling, convulsions, those sorts of things. Certainly could be strep. This time of the year, I would put one management failure up there, pretty common, which would be water deprivation, right? If we freeze up water lines, and then next thing you know, we get a warm day, we didn't quite notice the lines were frozen. The pigs were without water for a little bit. As soon as they get the water back, they suck down water, and then they develop neurologic disease. Totally different than strep, but I've totally had people call and say like, "Oh, I think it's a whole bunch of strep." No, actually, it was frozen water, and once we get to that point, there's not a whole lot we can do. In this case, strep, most common cause of meningitis in pigs, so neurologic pigs, I certainly am thinking strep. Again, to all of you, strep is contagious to people. What's it look like in people? It causes meningitis too. Unfortunately, like it's the same deal. I think some of us know that people. Some people are pigs, maybe most of us are. Nonetheless, right, we get this idea that strep suis can certainly be transmitted to people. As we understand strep, though, almost every pig carries strep. They're colonized at birth. They carry strep in their tonsils, and so simply finding strep, like if I did a swab of the back of the throat of a pig and found strep, that doesn't really mean much. Now, if I had a neurologic pig and we lose that pig and I end up doing a necropsy and I get strep on a swab from around the brain, then strep shouldn't be there, right? And that certainly gets us to what's going on. So how do we get strep around the brain? Oftentimes it's the cuts, the abrasions. So we know we get those pigs that are fighting over teat space. Maybe we had a big litter, they're fighting over teat space. We got rough floors, they're down, kind of digging for the bottom set of teats as they're nursing, and they get those abrasions on them. Fighting, all that sort of stuff is a great way to move strep out of the tonsils and then into a cut and then into the bloodstream, potentially around the brain of a pig. Same thing can happen with us if we've got those skin lesions. So as we think about handling neurologic pigs, same sorts of precautions. Gloves, though, again, a big one. So if you haven't gotten the idea, almost every time we're dealing with sick pigs, we ought to be wearing protective clothing, rubber boots, and gloves, right? Because those same themes keep coming up over and over and over again. Ringworm, confusing name. It's not a parasite. It's not a worm. It's fungus, right? And we see it quite a bit on pigs. You get these kind of hair loss patches, the raised thing. They're usually itchy, much like ringworm on us, and we can find those. Usually they're more localized to kind of like we see here on the sow, kind of the blotchy lesions. Maybe not like what we would see with mange. Again, are same sorts of precautions that you want to be taking for those. Other things that come up, a whole bunch of different internal parasites. Oftentimes I hear folks say, I wormed them. Hopefully that means you deworm them, right? And what we're trying to do is control all these different worms. The ones that get an awful lot of attention, I think you really ought to pay a lot of attention to, are roundworms and whipworms, right? Those are the ones that we really would take a lot of stock in. Now, if you're in commercial swine production, you got slatted floors, you probably don't see a whole lot of parasite problems. This tends to be more pasture-raised pigs, floor-raised pigs, those sorts of things, where we can complete that life cycle because this is fecal-oral transmission. So Ascursuum, the roundworm, right? This is the one where you might say, I see worms hanging out the back end of a pig, right? These are big, long worms. And what's important to know here is infected animals dump a ton of these eggs into the environment, just millions of eggs, and then they can persist in the environment for up to 10 years. And so once you get a barn contaminated, a pasture contaminated, man, it is hard to get rid of this. And so you're going to have to use some active deworming to try to control it in that setting. And this is the worm that's responsible for milk spots. We could talk about the pathology of this, but basically you've got larval migration through the liver, and what you're seeing there are the scars in the liver after those larvae have migrated. Whipworms is probably one of those that falls through the cracks because, man, we like to throw ivermectin at pigs. It's kind of an easy dewormer to go with, but realize that as we're doing that, we might miss whipworms, and you can get a bloody scour out of these things to whipworm infestation. And so if you've got that, we're going to have to get a different drug in the regimen. Certainly talk with your veterinarian about that. Dr. Price hit on mange, by far the most common. probably external parasite that we see. We kind of know that the itchy pig, the irritation, especially up between the ears, around the ears, those sorts of things. We get the really classic mange-looking lesions. It's difficult to treat. You got to throw a bunch of drugs at it for a prolonged period of time, but you certainly can make some progress there. Probably the last external parasite I'm going to hit on here is lice. Not as common. We used to see a lot more lice. I think we certainly have got that problem maybe somewhat under control. Just realize lice are host specific, so are the mange. But so if you hear about lice at school or something like that, it's not the same louse on pigs. It's a totally different louse. And right, we get transmission pig to pig. This is not zoonotic. So the last one I'm going to talk about is African swine fever. Gosh, it's a disease I hope I never see here in productions. I've certainly seen it in the lab setting, but man, I hope I never see it for real. What this looks like, sadly, that list of things, right, is a whole bunch of other things we just talked about, right? I can come up with a lot of diseases we covered that look like that. That being said, right, we need to be extra precautious. We do not have African swine fever virus in this country. We don't want it. It's a highly transmissible, highly fatal infection. It would be devastating to the U.S. swine industry if we got it. And it doesn't matter. Commercial swine, we're going to lose export. Show swine, we're not going to be showing pigs. Everything's going to come to a standstill. Like, this will upset the apple cart big time if we get it. So we need to really take a lot of precautions to keep African swine fever out of the country. So what's that mean? Really limiting traffic, keeping those detailed records so we could trace things back if we ever had to. We're going to isolate sick pigs. We're going to clean and disinfect. And then one of the big ones really is if people have been out of the country, we're not letting them onto the farm for at least 5 days. And we're certainly not bringing international foods onto the farm either. So as we think about that, this virus can persist for weeks to months in food products. So like cured hams, we can persist for a while. So I think we're probably all been guilty at some point in time of maybe you're out in the barn eating a snack, not a great idea, and then maybe some food falls, maybe you toss some of that residual food to the pigs. They sure love it, right? But man, that would be a horrible way to bring that virus into this country. So we need to keep that sort of stuff in check. We're not going to do that stuff. Really have some of that strict biosecurity. And if you think you've got anything going on, right, this is where it's great to let your veterinarian know, right? Because we want to find this, if it gets here, we want to find it at the one and only farm it's at. I don't want to find it when it's spread all across the country. And right now we have to deal with it everywhere. If we can nip it in the bud as soon as it gets here, if it does get here, right, that would be better for everybody. So if you're like, man, there are a bunch of diseases I can't possibly, right, realize that we teach swine diseases over a period of a few years at vet school, and this was 30 minutes. I can't cover them all. Iowa State hosts the Disease of Swine Manual. It's a great resource. If you go Google it right now, they're going to say it's not available because they're updating it. But bookmark that site. There'll be an updated version coming soon. It's a great online free resource. Kind of gives you some tables in it of kind of like GI disease, respiratory disease, what it looks like, each of those diseases looks like, kind of age groups and different ways to kind of help sort it out. A really good resource, right, if you're just trying to figure out what diseases are going on in pigs. With that, just want to acknowledge, if you want to know more, the Swine-Test program here at Ohio State is a great outreach education program. Hosting a lot of this today, so check out the Swine-Test program if you're looking for more information. With that, I think I can take any questions.
Awesome. Thank you so much, Dr. Bowman, for sharing. We appreciate that a lot.